I think the most important take-home message for parents in preventing SIDS in newborns is that you can dramatically decrease the risk of sudden infant death syndrome by creating a safe sleep environment for your baby. And there are a couple different ways, a couple really important things to do for that. The first is that your baby should sleep in their own space. So that means they should be sleeping in a crib or a bassinet or a portable playpen that's been approved for sleep, and that should be their space and they should be sleeping there by themselves. We don't actually recommend co-sleeping. I know it's a very controversial topic, but co-sleeping has been shown to increase the risk of sudden infant death syndrome and sudden unexplained infant death through suffocation and other means. So it is very important for babies to have their own sleep space. The second important thing about a safe sleep environment is making sure that the actual space that your baby's sleeping in is safe. And so you want to make sure that there's no extra blankets, no extra stuffed animals, bumper pads floating around. We all see those beautiful advertisements of these lovely nurseries, and they're decorated perfectly, and the crib is filled with things that aren't safe for your baby. And so it's very important. Your baby doesn't care what the crib looks like. So it's very important for you to create a safe space in there. And what that means is that you want a mattress in the crib or the bassinet that is made for that particular sleep space that fits. You want a tightly fitting sheet in there and nothing else. Nothing fancy. The other thing, if you're worried that your baby may be cold or uncomfortable, you can put your baby in a warm sleeper. They do also sell sleeping blankets, which are blankets with armholes. So you can use that to help but those blankets won't come up over your baby's face. And so you can make sure that your baby's warm without having something over. And the most important thing is that your baby should always sleep on their back. Sometimes that can be hard. Sometimes your baby doesn't want to sleep on their back, but that's absolutely the safest place for them to sleep is on their back. One of the important things about the sleep space is that you do want it in the room with you. So we recommend separate but proximal sleeping environments. So babies should have their own space, but it should be near you, right next to your bed, right next to the window in your room, somewhere where you can see your baby and know what's going on with them during the night. And that may also help you feel a little bit better about not sharing a bed. It may also help if you're breastfeeding and allow your baby to be close enough to you that you can nurse and then put them back in their sleep space once they're done eating.